Welcome to Bristol Royal Hospital for Children. Last year, over 140,000 children were treated here across the South West and Wales.
Hi, I'm Addy. Welcome to Starlight, the Oncology Ward. We're located at level 7 at the top of the hospital.
I was diagnosed with acute lymphoblastic lymphoma, a type of cancer that affects my blood and immune system. I stayed on Starlight quite a few times, as well as other wards in the hospital.
There are 17 beds on the ward. All of these are private rooms with space for one parent to stay overnight. 10 of these are en-suite rooms.
There is a large parents-only room at one end of the ward. I think it's important that there is somewhere that isn't like the rest of the ward, so you can switch off a bit. It has facilities like lockers, microwaves, covered space, fridges and freezers, and a kettle for all the cups of tea. From up here you can see all over Bristol. The views are incredible.
What kind of illnesses do you treat on the ward?
On Starlight Ward, we treat children with cancer of the blood, of the bones and of the tissues, and some children even have blood-related disorders.
So not everyone here has cancer?
No, they don't.
What kind of treatment and procedures do you tackle here?
Alongside the administration of chemotherapy, we also undertake stem cell transplants, which can be from a donor who may or may not be related to you, depending on their tissue type match.
The play team is absolutely brilliant on the Starlight Ward. They are here to make you feel more at home, offer support, and can also help prepare and distract you during some procedures. We have a huge playroom which has great views across the city. Patients are welcome to use if they are well enough, and siblings can go anytime, supervised of course. Barrier nursing is something that you might see on the Starlight Ward. This is where patients have special rules on who visits them and what they have to wear when they go into a cubicle. This might mean there are special rules for parents and family. This includes strict hand washing and the wiping down of any equipment or personal possessions with alcohol wipes, which are taken into the cubicle. You may see people on the ward coming into your cubicles with gowns, gloves and masks. It's important that you stay as healthy as possible in hospital, as this is vital for treatment and a quicker road to recovery. We also need to keep the staff well to care for you.
The ward has an end of treatment bell. This is something given to them by another charity. You may see these on other wards across the United Kingdom.
It is rung when someone on the ward has finished their cancer treatment. It's a really special moment because this can take a long time and be very difficult for the family.
Apollo 35, the adolescent ward, also has an end of treatment bell. Sometimes older patients will spend time recovering on this ward and get to know it well. So some patients like me choose to ring the bell on Apollo. When you can't be at home because you need treatment, this is definitely the next best place.